Snoring, just a noise or a warning sign? Welcome to TMJ Unpacked, a podcast where we explore jaw pain, facial pain, and sleep through an interdisciplinary lens. I'm Dr. Natasha Nagpal, a dentist focused on craniofacial pain and dental sleep medicine. Whether you're a patient searching for clarity or a clinician looking to think differently, you're in the right place. This is TMJ Unpacked. My house is quiet, but one sound cuts through the silence. My dad is snoring, loud, deep, rhythmic. The kind of snoring that seems to echo through the hallway. When I was growing up, there was a pattern in our house. My dad would be sleeping peacefully, snoring loudly. And after a while, my mom would quietly get up, take her pillow, and move to another room, just so she could sleep. Nobody thought much about it. We just said, "That snores." At the time, it seemed harmless. It was almost part of the nighttime routine in our house. But years later, when I start working with patients and studying sleep and airway health, I realized something important. The story is not unusual at all. In fact, it is one of the most common stories my patients tell me. A partner sleeping in another room, a spouse wearing earplugs, a family laughing about someone's snoring. But behind those stories is something we rarely stop to think about. Because snoring is often treated like a joke. Yet, many times, it may be the first sign that sleep itself is not truly restorative. When sleep is not restorative, people rarely think about their airway. Instead, they compensate. They reach for a coffee, then another coffee, maybe an energy drink in the afternoon just to get through the day. Caffeine and energy drinks do not fix poor sleep. They simply mask the fatigue created by fragmented sleep. The brain feels temporarily alert, but the body may still be running on sleep that was disrupted all night. And many times, the first audible clue that something may be interfering with sleep is something families have been joking about for years. So, what snoring actually is? Snoring is extremely common. Large population studies show that snoring affects roughly 20 to 40% of adults, meaning that in many households, someone is dealing with it. Sleep researchers describe snoring as the sound created when airflow causes the soft tissues of the airway to vibrate during sleep. When we fall asleep, the muscles in the throat relax. If the airway becomes slightly narrow, air moving through that space begins to move faster. That faster airflow causes the soft tissues in the throat to vibrate, and that vibration produces the sound we recognize as snoring. You can think of it like air escaping from a balloon. When the opening of a balloon is loose, the rubber there begins to flutter and vibrate as air passes through. Snoring works in a similar way. As air moves through a narrowed airway during sleep, the soft tissues begin to flutter and vibrate, producing the sound of snoring. Another surprising thing about snoring is how loud it can be. In sleep laboratory recordings, some snoring can reach 60 to 90 decibels. To put that into perspective, 60 decibel is about the sound of normal conversation. 80 to 90 decibel is similar to heavy traffic or a vacuum cleaner. So for the partner sleeping next to the snorer, it can repeatedly disrupt sleep. Snoring is sometimes described as bedroom noise pollution. So when can snoring be harmless? Not all snoring is the same. In sleep medicine, we often distinguish between primary snoring and obstructive sleep apnea. Primary snoring refers to the snoring that occurs without repeated breathing interruptions or oxygen drops or significant sleep disruptions. In these cases, the airway vibrates and produces sound, but airflow continues and breathing remains stable. For many people, primary snoring may be more of a social concern than a medical one. Snoring may be considered relatively harmless when it occurs occasionally rather than every night. There are no witnessed breathing pauses. There is no gasping or choking during sleep. The person wakes up feeling rested. There is no excessive daytime sleepiness. However, because snoring and sleep apnea exist on a spectrum, Persistent or worsening snoring should still be evaluated if other symptoms like non refreshing sleep, gasping, choking, and excessive daytime sleepiness are present. Now, we need to understand that snoring and obstructive sleep apnea are not completely separate conditions. Instead, they exist on a continuum of airway narrowing during sleep. At one end of the spectrum is primary snoring, where the airway vibrates but airflow continues. As airway instability increases, breathing may become partially restricted. And at the more severe end is the obstructive sleep apnea, where the airway collapses enough to temporarily stop airflow. So rather than thinking of snoring and sleep apnea as two different problems, it is often more accurate to think of them as different points along the same airway spectrum. Many partners also notice something interesting. A person snores loudly for a while, then suddenly the snoring stops. The room becomes quiet. For a few seconds, there is no sound at all. Then suddenly there's a loud gasp or a snort, and the snoring begins again. That quiet movement may represent a temporary airway collapse. Eventually, the brain senses the drop in airflow and briefly wakes the person just enough to reopen the airway. This pattern of snoring, silence, and gasping can be a sign of obstructive sleep apnea. You can imagine the airway during sleep like a soft drinking straw. When we are awake, the muscles around the airway keep the straw open. But during sleep, those muscles relax. Now imagine that straw becoming softer and more flexible. If the straw stays open but vibrates, we hear snoring. If it collapses completely, airflow stops. So, in many cases, snoring is the sound of a narrowing airway. Several large studies have found out that habitual snoring may be associated with certain health conditions. People who snore regularly appear to have a higher risk of conditions such as high blood pressure, coronary heart disease, stroke. However, researchers are still trying to understand whether this increased risk is caused directly by snoring itself or by other factors that commonly occur along with snoring. For example, obesity, undiagnosed sleep apnea. Because of this, many sleep specialists consider snoring to sometimes be an early signal of breathing problems during sleep. Now, many people assume that snoring only happens in people who are overweight. While weight can increase the risk, it is not the only factor involved. Even in thin individuals, they can snore. Snoring is strongly influenced by airway anatomy, including jaw position, soft palate length, tonsil size, nasal obstruction. So, snoring is also about airway size and airway stability during sleep. Many people also notice that when they sleep on their back, their snoring becomes louder. The reason for this is gravity. When we sleep on our back, the tongue falls slightly backward. This makes the airway a little narrower and the tissues begin to vibrate. Because of this, in many people, sleeping on the side may reduce snoring. Another factor that can increase snoring is alcohol. When a person consumes alcohol during sleep, it further relaxes the muscles of the throat and airway. In a normal situation, when we sleep, the airway muscles naturally become somewhat relaxed. But after consuming alcohol, this relaxation can increase even more. Because of this, the airway can more easily become narrow or collapse. And when air passes through that space, the tissues of the throat begin to vibrate. The sound of this vibration is what we hear as snoring. Another effect of alcohol is that it can slow down the breathing control signals from the brain. In a normal situation, when breathing resistance increases, the brain activates the airway muscles. The goal of this response is to keep the airway open. But after consuming alcohol, this protective response may become less effective. Research also shows that the more alcohol a person consumes, the higher the risk of snoring may become. Another important reason for snoring can be nasal obstruction. The nose plays a very important role during breathing. A large portion of the resistance in the upper airway is controlled by the nose. Therefore, when nasal airflow is not optimal, the breathing pattern may change. When there is nasal blockage, many people begin breathing through the mouth. And when we breathe through the mouth, the airway in the throat can become narrower. This causes the throat tissues to vibrate more and snoring can increase. Snoring can occur at any age, but the pattern may be different in men, women, and children. Studies show that snoring is more common in men. One reason for this may be anatomy. The pharynx or the throat space in men is often slightly longer, which can increase the likelihood of airway collapse. Now, let's talk about women. Before menopause, snoring and sleep apnea are generally seen less often in women compared to men. One major reason for this is female hormones. Hormones such as estrogen and progesterone help keep the airway stable during sleep. They support the tone of the airway muscles and help maintain a more stable breathing pattern. Because of this, snoring is relatively less common in younger women. After menopause, however, the story can change. As age increases, hormone levels in the body begin to decline. When estrogen and progesterone decrease, the airway may collapse more easily during sleep. Because of this, many women may notice snoring beginning for the first time during this stage of life or becoming more noticeable than before. And at the same time, the risk of sleep apnea may also increase. Now, let's talk about children. Yes, snoring can also occur in children. In children, the most common cause is enlarged tonsils and adenoids, which can partially block the airway during sleep. One interesting thing is that children who have sleep breathing problems do not always appear sleepy during the day. Sometimes they may appear restless, irritable, or very hyperactive. Because of this, sleep breathing problems in children are sometimes mistaken for behavior or attention problems, when the real issue is the sleep quality. Now, treatment depends on the underlying cause. Options include weight management, reducing alcohol before bedtime, treating nasal congestion, positional therapy. Clinical guidelines also recommend mandibular advancement devices as a first line treatment for many patients with primary snoring. These oral appliances move the lower jaw forward and help keep the airway open during sleep. Snoring is one of the few health conditions where the partner often notices the problem before the patient does. What starts as a joke in the family may actually be the first signal that sleep and breathing need attention. Snoring is not just noise, it is information, and sometimes it is the body's earliest sign that the airway may be struggling during sleep. So the next time someone says it's just snoring, it may be worth asking a deeper question. What is the airway trying to tell us? In this podcast, we will continue to unpack the connections between the joint, the muscles, the airway, the nervous system, posture, behavior, and sleep. And most importantly, how collaboration changes outcomes. If this episode resonated with you, share it with a colleague, a patient, or anyone who is searching for clarity. This is TMJ Unpacked, and I'll see you in the next episode.